Good day, I am Shinker Balisa from BSN2A, and now I will be performing the immediate care of the newborn baby. So all newborn requires immediate care to minimize the risk of illness and maximize their growth and development. Prior to the conduct of the procedure, I prepared necessary equipment that I will be using and perform hand washing to avoid the spread of microorganisms that cause disease and contamination. So newborn immediate care needs first to breathe normally, to be warm, to be protected, and to be fed. Prepare the delivery area. Make sure to keep the delivery room warm within 25 degrees Celsius and make sure that the windows are closed. This is due to the baby's wetness after the birth and lack of fats. Newborn are at risk of hypothermia, or infants in cold environment lost heat. Second is to have resuscitation near the delivery bed. Have clean warm towels, cover, cloth ready for the newborn, and delivery materials that needs to be needed and supplies. So line up the materials for delivery according to the sequence of use. First, cord clamp, forceps, vitamin K, kidney basin, tuberculin syringe, scissor or blade, gloves, credas, and prophylaxis. For standard precaution, first use soap and warm water to wash and clean hands, and we also need double or 2 gloves. The first procedure is to deliver the baby prone on the mother's abdomen. This is to facilitate drainage of secretion. Okay, ma'am, I will put the baby. Okay. Then, second is to call out the time of birth. So, the time of birth or baby out, 10:40 a.m. For the third procedure, dry the newborn thoroughly using a thin, dry cloth or towel. Dry the baby by wiping the face, the eyes, the head, the front, the back, the arms, and also the foot of the baby. Stimulate the baby to breathe normally. This is to ensure that the lung expulsion and take the first breath. Letter A is stimulate the baby to breathe normally. This is to ensure that the lung expulsion and take the first breath. Minimize heat loss. Duration is 30 seconds. During the 30 seconds of drying, do not suction unless mouth or nose has secretion and other materials. Do not ventilate unless the baby is floppy. Letter B, if the baby is not breathing, dry and stimulate. If after 30 seconds and the baby fails to breathe, suction, change glove, and cut the cord quickly. Transfer to a firm, warm surface and start newborn resuscitation. Remove the wet cloth. Then, check the baby's breathing. Now, we're going to position the newborn on the mother's abdomen, skin-to-skin contact, or between the mother's breast. Skin-to-skin contact creates bond between the mother, increasing the chances of overall success of breastfeeding. This skin-to-skin contact helps to maintain the baby's temperature and expose the baby to the mother's skin bacteria. Okay, ma'am, I will put the baby on your abdomen cup. Add covers on the baby's back with dry blankets. So if this is not possible, place the newborn in a warm, safe place close to the mother. So I'm going to put dry blanket on the back, and we should also put bonnet on the baby's head. Okay, mother, I'm going to put dry blanket on the baby, keep her warm, and I have also here the baby's bonnet. after doing that, remove the first set of gloves. Now we are going to clamp and cut the cord. So the benefit of proper cord clamping first is to prevent anemia and to lower rate of intraventricular hemorrhage. So first, we're going to palpate the umbilical cord to check for pulsation for 1 to 3 minutes. After palpating for 1 to 3 minutes, we are going to put plastic clamp or tightly around the cord at 2 cm from the base or from the baby's abdomen or from the umbilicus base. Then after that, we're going to clamp cord using the instrument clamp at 5 cm from the base of the umbilicus. Now, we are going to cut the cord between ties with sterile instrument. So, after cutting, we are going to observe for oozing blood. If blood oozes, place at second tie between the skin and the first tie. Remember not to apply any substances to the stump and do not bind or bandage stump. Just leave the stump uncovered. So now I'm going to inject 10 IU of oxytocin into the mother's arm to prevent uterine atony or the failure of the uterus to contact following delivery. Okay, ma'am, I'm going to inject in your arm. For the eye care, wipe the eye from inner to outer canthus. Okay. Then, apply an eye antimicrobial within 1 hour of birth. This to prevent the eye from any microorganism that the baby may have contact during the delivery. The next, apply ointment from the inner to outer canthus of both eyes. Okay. Last, install at lower conjunctival sac with 1 drop of tetracycline on both eyes. For the injection, administer on the right leg 0.1 cc of vitamin K at the upper outer quadrant, vastus lateralis of the thigh. This is to prevent the hemorrhagic disease of a newborn. Next is to administer BCG intradermal. This is to help fight PTB on a baby. Then last is to administer hepatitis B vaccine on the left leg of the baby. This helps to develop antibodies to prevent the disease. 0.5 ml IM on the left leg vastus lateralis of the baby. Take anthropometric measurement of the baby to serve as the baseline data for the healthcare. First, the length. Using a tape measure, place the baby on the bed with paper underneath. Then measure it. Then, second is to measure the head circumference. Use tape measure that doesn't stretch and align into the eyebrow of the baby. Then next is to measure the chest circumference. Align the tape measure in the nipple line of the baby. Then next is to measure the abdominal circumference. Place the tape measure to the belly of the baby. Okay. Then note the data or the information or the anthropometric measurement. So now we are going to weigh the newborn using the weighing scale. First, we are going to weigh the clothes of the baby. Okay. Then note the weight. Then next is to weigh the baby. Okay, note the weight of the baby. Then after weighing the weight and the cloth, subtract the weight of the cloth from the total weight of the newborn.
Apgar scoring after 5 minutes. The baby's overall condition is recorded at 1 minute and at 5 minutes. After birth, using the Apgar score and reassess in 10 minutes if the score is 6 or less. 0 to 3, severely depressed. 4 to 6, moderate depressed. 7 to 10, excellent condition.
So get the footprints and stamp it in the chart. So we are done getting the footprint of the baby. So this is the result of the footprint together with the weight, height, and the information about the baby. Then assess the baby for any signs of illness, chest drawing, or grunting. So now we are going to initiate for breastfeeding of the newborn. Leave the newborn between the mother breast, skin to skin contact like this. Then every baby is different and the rest period may take from 30 to 40 minutes. Then encourage the mother to breastfeed, support the baby. And moms, help the baby to seek for your nipple po. Then please maintain skin-to-skin contact with your baby po and make sure that the baby is observed to breastfeed. Then, but before the baby shows signs of wanting breastfeeding from the mother, observe the newborn for signs such as opening of the mouth, tonguing, licking, and drooling. Make sure not to give the baby or the newborn baby sugar, water, formula, and other perlactiles. Do not give bottle or pacifier to the newborn. Introduction of pacifier before breastfeeding is well established can lead to painful latch on the breast and nipple, soreness for mother. Do not throw away colostrum. So colostrum is bright yellowish thick milk secreted into the baby after birth. It is rich in proteins, immunoglobulins, and has anti-infective properties. It is recommended to be given to the newborn baby and should not be discarded.